Hi, Dr. Bedi.
Can you see me there?
I can see you, but if you can align it in the
The
landscape mode.
background,
Perfect,
we can do
perfect,
this.
perfect.
Okay.
Yes. How are you? That's a beautiful
Very
background
good.
behind you.
All well. That's the our front lawn.
That's beautiful. That's beautiful. And I think it immediately adds an element of peace in the whole
That's right. That's right.
screen.
I thought it's more a health talk, so we'll do it this way
Absolutely.
this time.
Absolutely. Hi, Radhika. Hi, Rashmi. Also, I don't think Dr. Bedi needs any introduction. He is the director of Orthopaedics Fortis and a very leading name in Delhi and very popular amongst his clients. So, Dr. Bedi, and a very fit doctor. Yes, he zooms around in the hospital. So, what's your fitness mantra?
So
What do you
hi
have?
Puja, and thank you so much for having me. So I got slightly excited when you asked me to talk or have a discussion on this topic,
Okay.
and essentially the reason why I sort of got excited is because majority of the patients that we're seeing nowadays in a practice, I mean the walk-ins and everything, especially the younger generation, are
Yes.
basically those who've actually sort of been not able to get into some sort of a fitness regime or something, and
Okay.
are becoming more and more sedentary. And
Okay.
I think I mean, I'm sure the compulsion of job, time, and everything is there with
Absolutely.
everybody.
Absolutely.
But the crux is, people who make an effort get through it, and
Yeah.
if you don't make an effort, you're never going to get
So
through it.
it's just that
So
leap,
that's what I thought
one
maybe
leap.
we can get it.
Yeah. One leap over your schedules and that one strong move and staying consistent in there. Yeah.
Absolutely. So I think the crux is the day you start thinking, look, everybody's got 24 hours, so do I.
Yeah.
And if they can do it, I can do it as well. And it's
Absolutely.
not just a matter of doing it for the sake of it. It's just because your body needs it. It's like
Absolutely.
taking your car for a servicing. If you're not going to take your car for a servicing, it's going to break
It's
down
going to break
sooner or
down.
later. I'm not saying completely gone, but it is going to break down every now
Definitely.
and then.
It's
So
a very
pushing
slow
yourself harder
process.
for
It's a
that.
slow process.
Absolutely.
And I feel
Absolutely
the
right.
human
Absolutely.
body is so beautifully designed, sir, that when I see the kind of strength, even people who come in now, my clients, like who have been sedentary for a very long time and come in with loaded injuries which have been over a period of a very long time, I tell them, look, your body is so beautiful. You have kind of abused it for a period of good 20 years and it has served you till then. So how about only 1 hour daily or maybe half an hour daily? It's not much.
I think it's the inertia of the thing. And, as I see it,
Absolutely.
everybody thinks they need to have some sort of a gym or something to get going. I mean, people
Oh,
don't realize
yes.
that actually you can use just simple things around your thing.
Simple things.
Starting
Yeah,
with as simple a thing as just going for a walk is a great starter. So all you need to do is,
absolutely.
get your shoes on, get some comfortable shoes on, buy some
Yes.
loose trousers, or in our country maybe shorts is better. Get
Yeah.
hold of a t-shirt. I mean, you do need to get rid of your chappals and all. You're not never going to make it.
Yeah.
And I mean, I'm slightly sexist out there, but do get rid of your saris and your salwar kameez and
Absolutely.
everything. You
Absolutely.
need some loose fitting, quick on, quick off kind of
Yeah.
a stuff, body
Yeah.
supports and
You have to be more
everything. And you just need.
hands-on, and you have to be more, now I feel oriented towards the health. I would like to share a slide here, doctor, where I would want you to take a call with the people in here that these are the problems normally people face. According to us, I have shared this slide. I think, is it there? Can
Quite
you
right.
see it?
I can see it.
Okay.
That's fine. That
So
makes so much
yeah,
sense.
so there are a couple of things which people suffer from, and I feel so. What I have seen, this is the space of 23 years to 35 years that people tend to get busy with everything else in life. It's career, it's marriage, it's kids, and health takes a backseat. And then crop up these things which I would like you to talk about.
Okay, so I think one thing we need to understand is your best bone mass or the peak bone mass, which is the highest strength of bone that you're going to get. You're going to get only till the age of 30.
Okay.
You can maybe 32. You can have a 2 year variation. Nobody gets a peak bone mass beyond the age of 30, 32. So
Okay.
what you got to understand is if you don't reach your peak bone mass,
Okay.
you will have to fall. You will be stable for a while, but it'll eventually the curve is going to go down. So the higher you get,
Hmm.
the longer it will take you to go down.
Makes a
But
lot
if
of
you
sense.
don't reach high levels,
Yeah.
you're actually never going to be in a good enough state. So, your formative years start off with your teenage years, and you can build it up into the late 20s and kind of a stuff. But if you
Absolutely.
do not push yourself harder, you will not reach a peak bone mass, especially in women. Sooner or later, the curve will actually start
And
to
these
go
conditions
down.
start cropping in, the ones which we have labeled, that is weakened bones, arthritis and stuff.
Absolutely. So degeneration will start in the body, and it's going to be there in every organ, whether it is the kidney, the liver, the heart, the blood vessels, the brain as well. So, people coming with all sorts of MRI scans and everything and showing, oh, there is a little, a signal in the meniscus, or the cartilage is showing a grade 2 change or something. Doesn't have any relevance. I keep telling them, look, I could have told this to you even before you get an
Yes.
MRI scan done,
Yes,
because this is
absolutely.
your normal
I've
degeneration, which
seen
will
you do
start
that. Yeah.
irrespective. Yeah.
Absolutely. Yeah.
So and the other thing we understand is the blood supply in every organ of the body is in response to what you want the organ to do.
Absolutely.
So the more the muscle moves, the more the body will supply. It's a demand and
And
supply.
supply curve.
And the body is capable of giving you everything that you need, provided you're going to do it regularly. So one day going for a marathon and the next month not doing anything doesn't
Absolutely.
work in your
It,
favor
it, it
at all. You need
backfires.
to
It backfires completely.
act.
Yeah.
So you need to do the little bit.
We
So
also
even
have
if you
the,
want to,
yeah, sorry, we also have the weekend warriors. When you said that one day going for a marathon and not doing, that is another thing. That kind of clientele is the one that comes to you with injury, like a
the,
ruptured Achilles tendon or something like that.
absolutely. But there is no doubt, just as Nidhi said just now, it's never too late,
It's
frankly.
never too
So
late. Yeah.
even though I talk about the curve going down, but even if you can actually lower the slope of the curve, which is what will do, as Nidhi said, what will happen if you keep exercising regularly, the
Hmm.
curve will not be a steep one, but really a very, very slow one.
So
And definitely, I can tell you, age is
people,
not a reason
absolutely,
to not
absolutely,
pick up your exercise. So it's never
absolutely.
too late. I totally agree with that on
Yeah,
this.
and
So
people
the
who come in with all these kind of uh, problems with to a doctor, that is arthritis, osteoporosis, blood pressure, diabetes, these are very common, right? 40 plus, these things start stepping in. According to us as exercise professionals, we advocate that this is all reversible to the point of management of pain. Of course, I can't say that you can reverse the cartilage damage that has been done, but incrementing your bone health, what Nidhi is saying, same thing, incrementing your bone health, your muscle health, everything kind of is reversed to quite a big degree once you start exercising. What do you say on
absolutely.
that?
So building up the muscle mass is a fairly important thing.
Mm-hmm.
One, it'll improve the circulation. Second, it'll actually make a difference on the preload on the heart. Third, it will actually make a difference on the lipid profile and everything. Your chances of burning up your sugars and everything is better.
Mm-hmm.
Your renal metabolism in terms of throwing off your metabolic products and all is actually in a more hyperdynamic state. So you're almost detoxifying yourself when you're actually getting to these kind of things. And totally, I mean, everything that Nidhi is saying makes so much sense
And
out
I'm
here as
sharing
well.
another slide with you here, and we would also encourage our viewers who are there who would like to throw in any questions regarding any kind of problems that their family members suffer, their parents who find it difficult to move, who find it difficult to get up from the chair, stuff like that. I'm sharing another pointer here whereby we have talked about different modalities of wellness. I will not say exercise, wellness. That is stretching, resistance training, walking, dancing. Massage is another very good tool to release your fascia, and meditation and deep breathing.
So I think can I add in there? So
Yeah,
the
sure.
essence is, again, it's that phobia that some people have, that look, my exercise will only happen when I hit the gym, is actually a false notion.
Absolutely.
And a lot of people would never hit the gym because they'll keep getting, this thing in their mind, and they keep on getting, I mean, slightly intimidated, because a lot of people
Yes.
there are in a very, very fit state. And you
Yes.
can just see, when they're pushing down the weights, and you go and you start off with your 15, 20 kilos, and somebody's just done about a 40 kilo, 20 reps and 40 kilos or something, and you start feeling little bit less of you. And frankly, that's not the way you need to think about it. So you are you, and it
Absolutely.
doesn't need to be, you do not need to be a the muscle man. You
Uh-huh.
can actually be the person who does stairs every day at work. You can be the person who parks his car 1 kilometer off from your place of work and actually walks that
Mhm.
path every day. So
Mhm.
find your own ways where you can actually do your exercise. So
Mhm.
dancing, who would have thought that dancing is going to be, such a very big thing? But I can tell you,
Thank you,
if
Shweta.
you
Yeah.
enjoy your dancing and
Yeah.
everything, go hit the dance floor. I
Yeah,
mean,
absolutely.
tons of exercise. I mean, I think, you can. It's basically physical
It
activity, and
is also,
as far
sir,
as
I
I'm
would say
concerned,
here that what is your physical state right now? Like in the sense, what is your fitness level? Somebody very obese who goes into a very high mode of dancing following the group activities which are happening in the gym end up with a lot of knee injury. So I would request people that whatever is your fitness state, go easy. Kind of take it one day at a time, kind of take it a small portion at a time, start with regressive exercises and move on to progressive exercises. What's your take on that, doctor?
yeah, no, totally. And another thing I would like to say is, don't take weight. I mean, don't exercise just for one purpose. So I see a lot of people who just tell me, oh, I wanted to lose weight, so I started doing exercise. It's actually much more than that.
Much
And they
more than
do
that.
get
Absolutely.
and they actually start feeling rather disheartened because weight
Absolutely.
loss doesn't happen that much.
Doesn't
Weight loss
happen.
is very complex. You need to, a lot of things go into it. And then, just looking at the scales every day, so, oh, I've done my week and have nothing has happened. That's okay. It wasn't expected to happen. Is that feeling of goodness, the feeling of being fit and everything
Hmm.
that works? That is what is actually going to make.
And I
And
think,
again, I mean,
yeah,
again, Nidhi's, I think, bringing out some very interesting points. Consistency. I mean, you need to push yourself. It's not going to be a one-day job, not once a week, and keep on sort of having a time slot in which you can actually do it. And that is going to be very, very important. And that's where I would like to bring in the concept of the morning exercise. I know a lot of people say, oh, I can't do the morning thing. I've got to reach work and
yeah,
everything.
yeah.
Evening things do not work out. Something or the
Sometimes,
other happens
yes.
in the evening. Some friends coming over,
So,
some relatives going
Shweta
over,
here is
you getting
asking a
work.
question, sir. Any kind of physical activity according to your health status? Oh, no, she's saying that. Yes, Shweta, that's what it's about. That if suppose you have a knee pain and you're not able to do running, then you can look at light walking with the proper shoes on, upper body exercises. You can look at wall push-ups. You can't dance also if you have a knee pain, right, sir? So even if you are going to a doctor and you are following a RICE modality, that is rest, ice, compression, and elevation, and you can't do, but there is so much you can do, so many other things you can do, and
Yeah, so I mean,
consistency. Yes,
a typical one for the knee patient is, do
absolutely, yeah,
cycling or do swimming
yeah.
or something.
Cycling is very good,
As long
sir.
as you're not putting too much weight on your
Knee.
thing. I mean, that's going to be fairly
Water
good for you in the
exercises are
knee
amazing.
pain.
Water exercises are so good.
Absolutely,
Yeah. Another
absolutely, and
slide I would like to share with you here is it visible, sir?
it's
So
totally
it's a
visible.
pointer three where we want to help people reach their goals, and there are small things that they can add into the schedule. That is a timetable, a 10-minute walk. Avoid social opinions. As you said, that yes, going to the gym can intimidate you, but at the same time, it is totally what you allow it to, kind of do to you. You can also become mentally very strong, take inspiration, and move on. So it's like a situation comes in life and you allow what it may do to you. But you are right, initially when people start on their fitness journey, it is very, very intimidating to see other people work out so much and you not being able to do anything, in fact not even knowing how to operate the machines out there. So would you like to go on with this?
So I think, getting hold of somebody to actually guide you through it,
Yes.
whether it's a trainer, whether it's a physiotherapist, a
Hmm.
yoga guy, it's totally up to you. You need to find your own zen somewhere where you think, look,
Absolutely.
this is what
Somebody
really
to
works for
hold
me.
hand initially. Somebody to hold
Absolutely.
hand, get you there. It is just like the schooling process, how we needed teachers in school, right? How we
Quite right. Quite
how
right.
we need
I
a
think, yeah.
doctor, we need a senior consultant, like even doctors for that matter. Everybody thinks that they can do their home remedy, but sometimes you need specialized guidance. You need the doctors to be there for you. You need to hold hand and move on and tide over that phase.
Yeah, and do set your goals. You need some sort of a this thing that, look, I'll get 15 minutes done today. I'll get next week. I'll try for that half an hour. You can't be sort of without any goal at all. So you need to have some sort of a target or something which you want to achieve. But again, I mean, as Nidhi just pointed out, weight will not be. Please do not get demotivated by weight,
It's
and
a
do
big
not
myth.
get.
In fact, the BMI is a
It's
big myth. Big BMI just talks about your weight in kilograms upon height in meters square. That's a very redundant formula because the weight, we are not talking about the muscle weight out here. To me, exercise is only and only strengthening of your muscles and going and something that helps you do your daily activities better. What do you say, sir?
Quite, quite right. And I think I would, add to it. So, things which give you happiness, things like music and
Absolutely.
all,
Yeah.
that can be added at the same time. Whether
Yeah.
you get your headphones out, you can have, I mean, all the gyms have TVs and all playing with lots of, loud sounds. And the reason is, it takes your mind off the
Takes your
fact that you're
mind off.
doing a very
Yeah.
monotonous kind of
It's
a job.
easier
So,
to get off
because
the inertia of rest, which the point you had brought in the beginning of the show,
absolutely.
that this is this
And you can
inertia you
actually
need to
now
overcome.
log on to some podcasts and all if you're one of those very academic types who wants
Yeah.
to listen to things. And I'm quite recommend the idea of listening to something like Bhagwan Rajneesh or something. There's a hell of a lot of tapes and everything going
So
on, and
much
you can
there.
anything
So much there.
you need to find your piece with that. So I think somebody asked a question about people with knee pains and whether they should walk. Can I just
On
say,
hard surface, what is
walking
this question coming up, Sakshi?
walking is, yeah, whether they should be walking on
On
a hard surface or on a soft
soft
surface.
surface.
So walking is going to be essential. I mean, knees are made for walking. If you're not going to use it for walking, it's not going to go down well at all. So I'm not saying push for long walks or push of sort of mega walks and stuff, but you need to walk. Without walking, circulation doesn't never really kicks off very.
Bedi for a moment. He'll be joining in. Yeah, Dr. Bedi, we had lost you for a moment. When you have knee pain, sir, I would like to add in a point here with your permission. When you have knee pain, if you can walk with the right shoes on, which should be half a size looser, broad at the apex, at the front foot, they should be broader. And if you can get a steady soft ground, which is not up and down, which doesn't have potholes, yes, it is definitely better than a hard concrete surface because the fact that you're not jamming your knee too much every time. But you should not stop walking if you have a knee pain. Is that what you're saying, sir?
That's and you're not going to hit too many long soft surfaces in this well in at least in Delhi. So but don't be put off by that and say, look, oh,
Yeah.
I'm never going to find the right surface.
Yeah.
So whatever you do is good. Ideally, yes, soft surface. Shoes are actually fairly good nowadays. I mean, they
Yes.
take away a lot of impact from the walking if you can manage that.
Yeah. Another slider, sir, I would like to. So, in this, we have talked about the pointer three. One thing we are missing out, sir, which I'd like to talk is resistance training. Resistance training, according to the studies, that is, if you do through a TheraBand or you do through cables or you do with weights. Ideally, a beginner should start with TheraBands and cable mode exercises. It helps build muscle. Muscles help move the bone, and it also helps you increase your bone density. What do you have your take on that?
Yeah. So it's like it's like you have a Rolls Royce, but you got no petrol in it. That's the
Oh,
kind of thing you would do if you don't have muscles. And the driving force is the muscles. And if the muscles are
absolutely.
not going to work for you, you just stuck with the body which is not going to do anything and actually just almost collapse. So, and I can tell you the muscles do not get built up with just simple cardio on many occasions. You can use your body weight if you want, or you can use some resisted weights. You can do lots of things can be used, but you would need to switch on to some sort of a resistance pattern of exercise one time or the other in your life. You can pace
In our
yourself. It's
last
not
talk,
going to
sir,
be
last talk you were very insightful about one thing, and we had discussed how there is a big myth about not eating eggs and stuff, and that's why most of the traditional families have a protein deficiency in their daily diet, which is a very big
quite right.
problem. They assume that dal and milk is providing them with the necessary protein, and that's where it goes off.
Sure.
That's where the
So I
health of
think
women.
one thing we all pretty much agree on now. You can actually push a little bit of fats into your diet, much more than what
Absolutely.
we used to talk before.
Yeah.
Go low on carbohydrates, but push
Yes.
push push on the fat. Then again, you can take luxuries. If you're exercising, you can take more luxuries with your diet. But if you're not exercising, you don't have those luxuries at all. It's like, having that ice cream from Mother Dairy because, you need to reward yourself. So that's something you need to do once you start exercising. You just
Yes.
realize that, look, I think, it's not a punishment. You need to go with the idea, I'm doing it because I enjoy it.
It's a
And you will.
constant
It
process.
will
It's
become,
very relative. You
yeah,
have to just go on. You will fall down, but you will get up again. And
yeah,
walking is a very good speed. Walking at a very good speed if uh, there is always pain
yeah, I
in
can
the
understand.
feet,
I
especially in the
think the
heel area.
references to the
So
Yeah,
she's
the
talking
references
about
to
the
the heel pain, and
heel pain. Yeah,
the reason why people actually get heel pain is mainly because of tight calf muscles.
side
So
gastrocnemius.
can I suggest
Absolutely.
that before you start going, go with your calf muscle stretches and go your plantar fascia, which is the sole of the foot. So stretches in which you're against a wall or something and you pushing your foot in, and stretching the sole of your foot is a good idea. But the calf muscle stretch is the winner in this.
So
Do that,
Rini,
and
it's
whether you
always good to do a little warm up, maybe just like marches and stretching before you hit the road or for your walking schedule. Because when you tend to put your music on and when you start walking, you tend to get a momentum and you start walking fast very quickly. And if you've not warmed up your muscles enough, it tends to come forth in the form of a heel pain or a calf pain.
Yeah, actually, I think it might be worthwhile, Pooja, if you do a session on simple walking and running as well, in terms of getting
We could
ready
we
for
could
people
line
to
it up
walk
for the
and run.
next and a few stretches in it also, maybe the calf stretch and all.
That's right. So if you add a few stretches, that is to a preamble to that, you can add these stretches, and then you can maybe add up with things like what are more suitable exercises for the more seniorish people and slightly more and
I'm
some more for the juniorish people as well.
Yeah,
That might be
absolutely. Some stretches
something
are
to
very
have
universal, I
have a
think, like hamstring stretch, a gastrocnemius stretch. I think these are very, very universal.
So I think
Little
in fact
shoulder
it'll be better
mobility.
if you add some stretches, if you make a video of some stretches. I think that would be
I could try
quite
that.
good as well.
I have another question here from Sri Devi. Please provide us some insight about yoga and how a beginner should approach and what sort of precautions are needed. Okay. So would you want to take on this or should I pick it?
Well, why don't you start and I'll join in.
So, Sridevi, what I would say that yoga is very good for meditation, for stretching, for strength building, but some moves of yoga take our joints beyond their range of motion, as we study, sir. Hyperlordosis, a lot of overextension of the hip joint, messing up of the spine. That is something if you can avoid and if you can actually get a very good yoga teacher who can work it around the right way, the correct asanas to stop, when to stop. That's the thing. And otherwise, yoga is fine. What do you say, sir?
So yoga for me is a great thing. I think it's part of it is the mindset of our country. We're not sort of into the massive fitness things which maybe the Western civilization seems to have much more of it. It just seems to fit in with the Indian psyche, in my opinion. I mean, don't make me go into the details of that. That that
No, no,
that
it's
might be
fine.
unsavory.
Yeah,
So yoga is all about stretch, and there is zero doubt that stretching is a fundamental. If you do
absolutely.
not stretch, you will not be able to do weights. You will not be able to do your cardio. Nothing will happen if you don't stretch. So for
Absolutely.
me, yoga is a basic foundation. It doesn't need to be as a yoga. You can do it, like a physio kind of a setup. You can do a fitness kind of stuff. You just need to understand that what it is doing to your body in terms of the flexibility of the joint, the stretching of the ligaments and the muscles.
There's another
That
question
makes
coming in, sir. Can bunions be improved with exercise, sir?
the answer is a no, zero chance at all, zero chance.
So
So
when
sorry.
we do barefoot, we tend to focus. You don't agree with it, but we focus on strengthening the abductor hallucis back through isometrics. We try and keep working because it's such a strong. If the bunion is very strong, it is very difficult. And I've seen even if when we do try and do taping of the foot, it creates a lot of pain because I think a certain shape has already been set of the foot. But
So what you can
yeah,
actually try is doing some sort of a bracing or a splint or something which keeps it pulled off.
okay,
You will not be able to reverse it as a
okay, yeah.
as a known to
You can
fact.
just manage the pain.
You could stop. Yeah, you could stop the progression of it. That, I mean, I'm agreeable with that. The progression can be stopped, but what is there, if you already have a bunion, you will not make the toe go back. But you can stop the progression so it doesn't. And remember, bunion doesn't always have to be a problem. You know,
Yes.
majority, when I say majority, 85 to 90% will not give you any trouble at all.
There are
Only
two
a small
things which
percentage.
women can really do to kind of stay away from it as much as possible or maybe reduce the intensity. One is not to wear high heels. Try and keep your foot in the normal position. When you're wearing heels, your foot goes in like this. You're tightening your calf muscle further. And second thing is not to wear very narrow-toed shoes. Wear something which is wide at the forefront.
So the shoes make a difference. I mean, that's what most of the studies have shown that. But I mean, I hear what you say, but I'm very surprised. The Indian population really doesn't wear too many tight shoes. The women, most of the time
So,
are in
so many girls
slippers or
are wearing
something.
bellies all the time. I mean, I as a kid also, I remember when I
Yeah,
was
but you need
13.
you should see some of the pointy ones which the Western people seem to wear. I
Yeah.
mean that's the really pointy kind of a stiletto kind of thing. I don't see too many women in India wear it. That's my personal take.
No,
I
sir,
don't know.
they go gaga over it. They love it. I mean, most of
Yeah, but
the
you
footwear
see
closet.
you can't wear it for more than about you'll wear it for about half an hour, 45 minutes, and you'll have to
Yeah,
give. But anyway,
yeah.
that's topic
The
for that.
last slide we are sharing in here is we are talking about yes, how to start. The initial pain, inertia, we have already spoken about it, how to get over it. You have to just keep going. The remedies in case of initial pain. So when you start exercising, you may feel a pain coming in. That is called DOMS, delayed onset of muscular soreness. So the best way we advocate is, sir, rise. What do you want to say about it, sir? And little
So I can
mobility.
tell you, if you've been a couch potato for a while, expect pain. It's not going to be easy, but the more you concentrate on your stretches before you go into the hardcore exercises, the lesser
Yes.
the pain that you have. The more the warming up you do, the lesser pain that you have. Identifying the sites of the pain, icing them when you get back from or taking a break sometimes, stopping a few exercises in between is the way to do it. So rather than plowing on more and more, you just need to, just for a few days maybe, occasional medication and all is not a bad idea.
Not a bad
Cold
idea.
packs
Just
work
getting over
well.
the inflammation.
Stretch
Yeah.
stretch that area more.
Yeah.
That's gonna don't let this be a demotivator for you. Don't
Yes.
let come back and say, oh, I got pain, I think
Pain
I
should
need
not
to
be an
stop doing.
obstacle to stop. It should be the reason that you have to keep your light mobility exercises on. So if you feel you have a stiff shoulder and if you're moving, doing a light mobility exercise like a simple shoulder rotation, even half circles, I would say even quarter circles, it really helps you.
Sure. I think somebody was
Yeah, there
asking
was a
about
question. Yeah, there was a question. Sridev is asking about breaking knuckles. What's
yeah,
that?
I think that they're talking about
The tick
they're
tick,
talking about cracking your
cracking
knuckles
your
and
knuckles.
everything.
Yeah,
So can I say, get over it? It's a tick.
yeah.
It has got
It's
no relevance to developing arthritis, got no relevance to a joint problem. Getting
yes.
that clicking sensation when you press your fingers hard, or you try to do that with your neck. It's a tick. Give up on it. It's a behavioral issue.
It's
It's
just a
not.
bad habit.
It's
It's just a
not.
bad habit like digging your
It's
nose,
just a
nothing
bad habit.
else.
It's just like some people will keep doing this kind of a thing. It's
Yes.
just something you work yourself into. The sooner you realize that it doesn't
Yeah.
help you out, it just makes you awkward and gets you into that
Yes.
comforting feeling. That's all
Yeah.
it's doing.
It's just a bad
It's
habit.
like enjoying the cigarette. You can keep smoking, but it's a bad habit.
Yeah.
So
Absolutely.
not worthwhile thinking about it. It's not a precursor for anything at all.
So
Oh,
I,
the other thing I was going to say is
yeah.
make sure you hydrate yourself well when you
Yes.
start with your
Very
exercise.
important. Yeah.
Improve your liquid content when you start going for it. So don't get demotivated in the beginning.
Yeah.
Find your inspiration. Look at it as a source of happiness, not as a source of
And
punishment.
if you can
Don't
just keep
get too
stretching
bogged
the
down
time
with it.
slowly and slowly, start with 10 minutes, then 15 minutes, then 20 minutes, and keep rewarding
And don't
yourself.
don't don't get bogged down with equipment. You don't know, everybody does not need equipment.
Yes, we must
Don't
talk
get
about
bogged
this
down
in
with
our
the
next
idea that
show as to what
yeah,
all
don't
has
get
been
bogged down
floating
with the
around in the
idea that
media.
you don't have enough muscles building up and everything. That's not the end all and be all of it. So
Absolutely.
it's a lot of things that go into it, and enjoy yourself and be healthy.
Thank you so much, sir. Thank you so much for
Okay. Thank you so much.
being there on the talk and
Thank you.
helping everybody else through. And thank you all guys for being there and joining us for this morning chat on Sunday. And hope you all stay safe, stay fit, and stay well. Stay tuned. We'll be coming in next week, I think, sir. We can talk about a lot about the kind of stretches and the stuff that is going around on the net, what to do and what not to do. Yeah?
Sure.
Thank you so much, sir.
Okay.
Bye-bye.